Hi, I'm Dr. Dean. I'm an eye specialist in Mbombela, and today I just want to talk briefly about preservative-free drops. You may have heard of preservative-free drops, and you may have been prescribed them or have been asked to look out for them. I just want to discuss why that's an important thing. So typically eye drops, everyone would know, will normally come in a bottle like this, when they have a seal on them, and when you break that seal and open the bottle, what happens now is you're exposing these eye drops to the environment. And when you expose them to the environment, you're exposing them to bacteria. So bacteria then potentially can come in here and they can contaminate your eye drops. And so that's one of the reasons we normally say wash your hands before opening your bottle or handling a bottle, with the lid, not to put your fingers inside there, to find a place to put it on the counter or on a tissue or somewhere with it out being capped down, and especially with your eye drop bottle, that when you're putting your eye drops in, that you're not touching the surface of your eye, because if you're touching the surface, you're contaminating this. The drops go back down and then potentially you can contaminate this. So to try and avoid or to limit the contamination of any eye drops, drop manufacturers place preservatives in them. So the same way that milk goes off when you open your milk a few days or a week later, your milk's off, with eye drops, when you open them, there's a time limit until they expire, and that depends on the drops, but it's anywhere between 4 and 6 weeks. Some bottles it's longer. And what they place in these drops is normally benzalkonium chloride, often known as BAC, and that preservative in the drop can be detrimental for some people. So you can react to it. Some people have allergy to it. It can irritate their eyes, and so you're taking a drop that is a lubricant, which is designed to soothe the eye and lubricate and make the eye feel better. And if you have benzalkonium chloride in it, for some patients that can be detrimental. So there's a big push to try and produce preservative-free drops, and there's multiple advantages to that. So some preservative-free drops come in a special container that have single drops or have a valve in it. But the most common way that you can pick up preservative-free drops is they come in individually little wrapped ampules like this. And what that means, so normally instead of having a bottle for a month, you get a box of these, and there's normally 30 of them in a box, which means there's one for each day of the month. And these don't have benzalkonium chloride in them. They don't have any preservative. That's why they're called preservative-free. And what that means is, so firstly you will twist and open these. So now this drop is open. Now, because this isn't preserved, it's not going to last a month. It's going to last a day. After 24 hours, you need to throw it away. But you haven't opened up this one, and you haven't opened the rest of the box. So these are still sealed and sterile and clean. So you can use them 3, 4 weeks, 5 weeks, 6 weeks later. You know, you can look in the box to see when they expire, but they last a long time because they're individually wrapped. What's often a mistake, though, is patients don't realize that you can recap these. So you can, once you've torn it open, there's normally 5 or 6 drops in there. You use the drop, you can cap it, and then for the rest of the day you can keep using this. After 24 hours you throw it away, and then you will open up a second one to use that. Now the advantage to that is, if I lose one of these, I've lost one of these. I haven't lost my whole bottle. If I lose this bottle, then that bottle's gone, and so it can be quite costly if you don't always remember where your drops are. Where these, especially patients who are suffering with dry eye, they often have bottles of drops all over the house. You may have one of these in your handbag, in your office, in your car, wherever, and if you lose one, it's not really the end of the world. And obviously the big thing is they aren't preserved, so no benzalkonium chloride. You don't get that irritation, especially in patients who have chronic dry eye. So that is the advantage of using preservative-free. Some drops don't come in preservative-free format, and so that can sometimes be an issue, depending on how sensitive patients are to preservatives. But yeah, so that's the basics of preservative-free. If your bottle comes like this, it's probably not preservative-free. If it comes in ampules, it probably is preservative-free. There is an in-between with special bottles with special applicators that have seals and valves that help to prevent the contamination of the drops. But if you can, always choose preservative-free if the option options available. Cool. Well, hopefully that was helpful and interesting, but if you have any more questions, please feel free to contact us.